Hi, Leigh-Ann. Welcome. How are you?
Thank you. I'm good. How are you?
I'm good. Thank you. Thank you so much for agreeing to join. So this is the second episode of the Sheroes Collective. It's a podcast, and the podcast is really about showcasing heroes in our communities. And I know you probably won't consider yourself one, but it really is about women and gender non-conforming individuals who are doing amazing work in our communities. And so with that said, my name is Janae Sparks, and our guest today is Leigh-Ann van der Merwe, who is a self-identified transgender woman from rural Eastern Cape. She founded a social health and empowerment feminist collective for Transgender Women of Africa and is the first transgender-identified national commissioner deployed in the Eastern Cape province for the Commission of Gender Equality. Is that correct? Yes. Leigh-Ann is an intersectional feminist focused on the various socio-economic and cultural issues affecting women in all our diversity. And she's a public health scholar who is published academically and in various journals. So I'm reading all of this, but I actually know you.
Yes.
Leigh-Ann is an activist, and I say this to you, you are actually such an example for many people out there. And I think what struck me about meeting you the first time was that you seemed fearless. And I don't know how true that is. I've been engaged with you in civil society and you don't hold back. And I think that was the one thing that really stood out for me. But then I got to know you within your organization. So I'm thinking of just introducing people to what made you decide to start an organization that deals with feminism in its diversity, but also then with a strong focus on championing the rights and views of transgender women.
Thank you, Renee. It's such a big honor to talk to you. Yeah, I know it was such an extraordinary day when we first met. We were together at postgraduate school. And I didn't think our journey would pan out in this way. When you go to school with people, everybody tends to go their own way, but you and I have remained in the sector. She was really started in response to a visibility of trans women. And if I can just very quickly narrate this visibility, is that when we went to LGBT groups, trans women didn't seem to be represented there. We went to trans groups, trans women didn't seem to be represented there. We went to feminist spaces, trans women were not represented there. And so I asked myself, where is it that we are taking up space? So she really came about politically as establishing a voice for trans women. But then because of the context of the Eastern Cape province, we also became a service provider because there were no services. Like the queer community just didn't have a clinic where they felt they were comfortable going to, or a space where they felt like they had support or community, etc., etc. So it was really established in terms of wanting to generate a narrative that is about us, but that it's also for us, with us, and by us.
That's fantastic. So yeah, I know you love that. Just tell me, because you've touched on, you've done it because you've started because of all of this, lack of visibility and lack of access. What are the barriers that face transgender individuals in accessing health, for example?
Right. So I think when you read my bio, I brought up the concept of intersectionality, is that when one conceptualizes access in South Africa with the historical legacy of apartheid, it forces one, it necessitates one to consider intersectionally, where is this trans person located? So my own access as a trans person has been determined by my geography. For example, I'll make an example of Groote Schuur as a hospital. Groote Schuur is one of 2 tertiary hospitals that offer gender-affirming surgery. But in reality, if we ask ourselves, what are the chances of a trans person from Mthatha getting onto a list at Groote Hospital or at Steve Biko Hospital? So first, one must explore these personal dynamics. For example, my being a person of color determines my kind of access that I have, or even my education level, or the kind of resources I have at my disposal. For example, it's very difficult for a trans person from the Eastern Cape to have sources like the internet to tell us. I mean, I grew up in an era where we didn't have the internet. I just knew that I felt different, and I read about another person like myself in an old magazine back in the day, like before the era of the internet. And I never even had a name for it until I managed to get to Cape Town and get to Groote Hospital. I then had a diagnosis, right? But even within this democratic dispensation, like the wheels are turning, but they're turning very slow. They're turning at a pace that is not conducive to people's health and well-being. So one, there are those personal factors that determines my access, my race, my education, where I am, the political factors of whether I have a facility in my area, whether I have a trained nurse in that facility who can work with sexual and gender minority. And then, of course, there are the socio-economic determinants, having money, having access to a job. Some of that is improving, but a lot of that is still lacking. We still have more barriers than we have facilitators, and that, remains a big concern.
It's unbelievable, right? We're in 2023 and we're still fighting just even for the acknowledgement of transgender pop, or actually any non-conforming. I mean, I think the only key populations that are kind of really more spoken about within a health sector would be MSM and keyword, so people who inject drugs or use drugs, and sex workers. But very, very seldom do you hear someone championing and saying, but what about the transgender population? Where do they fit in? And it seems that it's only something that there's appetite for within civil society spaces and it's donor funded. What do you think what would it take to actually change that narrative to get every facility to not just be transgender friendly, but just, I think, for me, it's painful because the minute we sensitize to sex workers, then you find that facilities are now kinder to sex workers, but they somehow then turn onto another population. How do we get them to actually just be accepting of anyone, irrespective of all the diversity that you've just mentioned? How are we going to get there?
Right. So I think the issue around the concept of sensitization is somewhat complicated for me because, if we think about it, if we think about the construct of sensitization, what does it really mean? Essentially, sensitization is asking a person to treat another person like a person. That's what it comes down to, right? And so for me, I think I've moved away from the idea of sensitization because it tends to be very siloed in its approach. So there's a broader concept called diversity management, which I think is so much more useful in the sense that when we use the broader concept of diversity management, we get to talk about what are disability rights, what are sex worker rights, what are the rights of people who inject drugs. We're not talking about communities in silos, but we are talking about recognizing all our intersectional diversities, because you'll find that one day you'll have to go in and talk about sensitization for sex workers. The next day it will be trans and MSM. The day thereafter it will be people who inject drugs. And my question then becomes, at what point do we really, lay down and kind of like reflect on how can we do this better? How can we do this differently? And what are the innovations that we need to consider? So in my personal work and my activism, I don't just do activism for trans women, but I also really want to hamper on the fact that there may be a trans woman who come in here who is deaf. She cannot hear. How is she going to navigate your policies, your healthcare facility? There may be a trans woman who come in here who is in a wheelchair. How are we going to navigate those complexities? Because it will be today it's about trans women, tomorrow is about MSM. It's never ending. And
No.
so I think we need to innovate and to respond to these kind of challenges within healthcare facilities.
No, I totally agree with you. I do think you onto something about the diversity management. I mean, I've sat through diversity courses, within a health sector, and it does not even bring in any of that elements for us to have some form of awareness. And then just to come back to humanity, it's about how you treat a person, never mind
Right.
what they're coming in with. And I think that's where we struggle. Because a lot of the times
Right.
we're like, oh, a healthcare worker should be non-judgmental, or just anyone within a public service should be non-judgmental. But yet we are
Right.
facing exactly the opposite of that. And I suppose
Right.
it has a lot to do with our upbringing, our culture, who we are, what we see. We tend to also mirror what's happening within leadership. So if leadership is not going to really show us how to do things properly, it will just keep cascading. So we do have a lot of work to do, but I also want to acknowledge what you said, is that you've also, and similarly, other organizations in your space have also done such a lot of work in changing that narrative. And I think in years to come, we will see a difference. I think the important thing is getting each individual to actually raise their own voice because they have a voice. So forming part of an alliance with you. And because I think for a long time we spoke about being voices to other people, and that's not true. So I think in what I see when it comes to you is you are emulating something and you are calling to action the next person to join you on that call. So I hope I got it right. But
That's right.
yeah.
That's right. I cannot stand that language around the voice of the voiceless, because nobody is voiceless.
No, absolutely not.
Nobody is voiceless. We all have a voice. Other voices get amplified more. We need to determine how best, what innovations can we bring about to support the amplification of voices that we don't typically hear within the discourse of public health. Similarly to the issue of when implementers say we need to do capacity building. Capacity building for me is very different to capacity enhancement, because capacity building assumes that somebody has nothing. You're starting from a blank template. And what I find with my work in the field is that people know something. If you go to clinics in Umtata, people can tell you the stories of how they've been discriminated. And normally, those stories are really a springboard for, catapulting people into creating conditions that are better and better responsive to our needs. Yeah.
No, I love the spin you put on that, because it is true. When we identify issues and we actually speak about those issues, we then, and of course the other parties have to be open to that discussion, we then see change. So I'm really hoping that whoever's going to listen to this, who are in positions of power within our health sector, within even our judicial system or the police themselves, think about how it's possible for you to change the narrative around some of these things. And challenges, let me say, not things, but challenges or barriers that we are creating for the next human being, which is really just unnecessary. So I absolutely agree. We need to be taking opportunities. And I mean, you've taken one of them. I think it's amazing that you're now a commissioner. And yeah, tell us about that journey. How do you go from starting an NGO, for championing for that, getting grants, and now moving into this space? How do you kind of hold all of this?
It is difficult, between, being between two jobs, at SHE and at the commission, and, school work and balancing that with family life. It's not easy, but I've realized a long time ago that the struggle is not about me. It's about creating the possibility that there's a young trans woman in high school now who must be made to believe that her dreams are valid and that she is able to achieve that, because there are days that I pinch myself to say that I'm in a semi-government organization, or rather a Chapter 9 organization that is holding the government to account. And when I went through the process of becoming a commissioner and being interviewed and making it onto the short list, I thought, okay, if the South African government does this, they are progressive. Because I mean, first world countries who would still discriminate against people for who they are, particularly in light of these kind of positions where people get to give critical input, make major decisions around how the country gets governed. So as I was going through that process, I constantly reminded myself, okay, don't get too excited about it. Don't get too carried away. And I made it, and I didn't even know when people were calling me saying, congratulations, Commissioner. As for my work at the Commission, I take that day by day, and I realize the intersectionality of what I'm doing in the NGO and how that that feeds into what I do at the Commission for Gender Equality, bringing a voice and an authentic voice, of trans women to the work of the Commission. So every day is a learning experience, but it's important to know that that I've made a way to get there, and that it's impossible for others to also. And this is me challenging others to really also take up that space and get into these kind of spaces where we make decisions about the lives of women in South Africa.
Fantastic. As you were speaking, I was already thinking about just that sentence, because I hope anyone who's listening, that transgender woman sitting in a very rural village that is thinking, what, do I need to keep living a life that's not authentically who I am, or what possibilities are out there for me? I think it's absolutely critical that we take up space. Whether it doesn't matter whether you thought you're coming from this really impoverished area or gang-riddled area or whatever it is, the world is literally, the platform is open. I spoke to someone earlier today who was saying to me, when we grew up, we did not necessarily have these role models. I mean, they were doing the best that they could, but there just wasn't these types of opportunities. And I think that when we see women pushing through, trying to do different things, trying to open spaces for others, we need to take up the opportunities to support and to be alongside these quests and these challenges that are put. So really, it's fantastic work that you're doing. And I know this is only the beginning for you, your academic. And I mean, I look at the articles that you've published and things. So there's definitely a voice that's coming through. And the fact that you are now in a platform that it's even more amplified means that you're amplifying voices of others as well and giving room and space for them. So that's absolutely fantastic. I had endless questions about your organization, but I think that what you've given is really the heart of it. So you've championed, your advocacy is about yourself. It's about the experiences you've made, if I'm understanding you, and the fact that you wanted something different for communities, for women, in all their diversity. You wanted them to experience something other than what you have. And I think you've created that space within your organization and now taking it further through the commission. And then I know you also in civil society as part of is it the LGBTI sector?
So a lot of different structures that I sit on. So I'm part of the technical working group for LGBTI, and we were responsible for the first ever LGBTI strategic plan within the context of HIV and AIDS. And South Africa actually led that. So So these are the innovations I'm talking about. And then I also sit on the Eastern Cape AIDS Council. I'm chairing the LGBTI sector within that forum. So, and then there are other engagements internationally about, at one point I was giving input to the WHO and how they, for processes involving trans people and how we can tie HIV to creating more equitable healthcare packages for trans people.
You need to just take a second for that. I hope you heard yourself. Like you're saying, I'm from a rural Eastern Cape province, and look at what you've achieved. So absolutely, can you see this is exactly why you are here? Absolutely, Ashiro. I mean, it's really showcasing anything is possible. So yeah, all the spaces you're in is fantastic. I was actually speaking about that LGBTI plan yesterday because I was asking when is it being updated. So please let it not be a tick box exercise, something that we hang up there and say we've done it for the first time, but that we keep it alive because it is something that we are so proud of, as well as the National Sex Work Plan. Those are things that, it's huge steps. It says that there is at least leadership backing and understanding that everyone should be looked at and trying to come up with tailored packages of health that speak to the needs of various parts of our community. So thank you so much for all the work you do and for the time that you've taken. And I know you are now on your way to travel again. So thank you so much, Leigh-Ann. I've enjoyed it.
Thank you, Renee. Have a good one.